Welcome, everyone. Getting drug information right, it's not just about ticking a compliance box. It's really about patient safety. The SFDA's guidance can look a little dense, I know, but today we're going to crack it wide open. We're going to turn these complex regulations into a clear, practical playbook that you can actually use.
Okay, so here's our roadmap for today. We're going to start with the one core principle that everything else is built on. From there, we'll get hands-on with the product label. Then we'll dive deep into the SPC for healthcare professionals, figure out how to write a truly patient-friendly PIL, and we'll wrap up with some key symbols and recent updates you absolutely have to know about.
So, first things first. Every single piece of drug information in Saudi Arabia is built on one foundational rule. If you can understand this single source of truth, everything else just clicks into place.
And here it is. That single source of truth is the Summary of Product Characteristics, or the SPC. You need to think of this as the master document. It's the highly detailed scientific blueprint written for doctors, pharmacists, and nurses, and it covers exactly how to use a drug safely and effectively.
And this creates a really crucial, unbreakable hierarchy. It's simple. First, you have the technical SPC. Then, and only then, comes the Patient Information Leaflet, or PIL, which is pulled directly from it. This is totally non-negotiable. You can't have a piece of information in the patient leaflet that isn't already in the SPC. This one rule ensures that what a patient reads is always anchored in the core scientific data.
All right, let's switch gears and talk about the product label itself. The first thing a patient or a professional sees. This is where good design and smart regulation come together to prevent mistakes.
And what's so fascinating here is that the SFDA guidance isn't just a list of what to include. It actually gets into design principles. It explicitly says that how you present information is just as critical as what you present. Using white space to make the drug's name and strength pop, that's not just a nice design choice. It's actually a mandated best practice to prevent medication errors.
The guidance is also super practical, which is great. It adapts the rules to the package itself. So a tiny 10 milliliter vial has a different set of requirements than a big blister pack. The small vial needs more comprehensive details right there on its little label. But for a blister pack, the absolute essentials, like the name and strength, have to be repeated over each individual pocket. That way, even if you pop out a single pill, it's still clearly identified. It's just smart. And of course, accessibility is a huge focus. For pretty much all products sold in Saudi Arabia, core information like the product name and strength has to appear in Arabic. Now here's a key update that made this even stricter. Storage conditions must now be in Arabic too, even for medicines that are only ever used inside a hospital.
Okay, let's zoom back into that master document, the SPC, and really focus on the clinical sections. This is where the precision of your language is absolutely critical for the people prescribing the medicine.
Now, this distinction right here can literally save lives. A contraindication is an absolute bright red stop sign. It means the drug must not be used in this situation, period. A special warning, on the other hand, is more of a yellow proceed with caution sign. It's signaling that, yeah, the drug can be used, but only if you have specific conditions or extra monitoring in place. The guidance is crystal clear. There is zero room for confusion between these two.
And here's a fantastic pro tip straight from the guidance that helps eliminate a really common source of medication errors. In the dosing section, all abbreviations are banned. You can't write OD for once daily or BID for twice daily. You have to spell it out, once daily. It seems like a small detail, but it makes the instructions so much clearer and harder to misinterpret.
When you get to drug interactions, which can be really complex, the guidance recommends this beautiful, clear, tiered structure. You start at the top with the most severe combinations, the ones that are absolutely contraindicated. Then you move down to combinations that aren't recommended. And finally, you detail situations where it's acceptable to use them together, but with specific precautions. It's all about prioritizing information for a busy doctor.
Okay, let's shift our focus to the PIL. And this is a huge challenge, right? How do you take all of that complex, technical SPC data and translate it into clear, simple, and actionable advice for patients? This is really where science has to meet empathy. This is probably the most sensitive, most difficult part of any PIL. Communicating the risk of side effects is a real balancing act. You have to be totally transparent, but without causing unnecessary panic. So how does the SFDA say we should handle it?
While the SFDA mandates a very specific patient-first structure,
you have to start with the most serious side effects. And crucially, it's not just a list. For each one, you have to provide clear, actionable instructions like stop taking the medicine and seek urgent medical help. Only after you've dealt with those critical risks do you list all the other side effects, and you do that in order from most common to least common. It's all about prioritizing the patient's immediate safety. And this table is a perfect example of that empathy in action. The SPC for a doctor might use a clinical term like very common. But for the patient reading the PIL, that has to be translated into something they can actually understand, like may affect more than 1 in 10 people. It's such a simple but powerful shift that makes statistical risk understandable for everyone.
All right, let's wrap things up. We're going to cover 2 crucial details from the latest guidance, version 3.3, that you absolutely cannot afford to miss. We've got a specific symbol and some really important content updates.
Okay, when you see this inverted black triangle, it's a critical signal. It basically means the product is under additional monitoring, usually because it's new to the market or it's a biologic. Its placement at the very top of both the SPC and the PIL is mandatory. It's a prompt for both healthcare professionals and patients to be extra vigilant in reporting any adverse reactions they see.
So, just to quickly recap the key updates from version 3.3 that you need to have on your radar. First, there are new, specific rules for labeling hazardous drugs with special handling and disposal instructions. Second, the guidance now gives clearer criteria for when to add post-marketing side effects to the SPC. And finally, as we talked about, that Arabic language requirement for storage conditions is now universal, even for hospital-only drugs.
So, when you step back and look at all this, it's pretty clear that the SFDA's guidance is so much more than just a regulatory checklist. It's a framework for communication that needs to be clear, compliant, and above all, patient-centric. The goal is to empower everyone, both professionals and patients, to use medicine as safely and effectively as possible. So the final question you have to ask yourself is this: is your drug information truly hitting that mark?